Did you know there's a connection between COPD and erectile dysfunction? It's a conversation that's not easy to bring up, but it's one that can't be avoided. As Dr. Sadiq Al-Nakib, a pulmonologist and critical care specialist, points out, men with COPD do have a higher prevalence of erectile dysfunction, or ED, up to close to 68%, and that does affect their quality of life. COPD, or chronic obstructive pulmonary disease, is a condition that affects a staggering 16 million Americans. It causes breathing problems like emphysema and chronic bronchitis. Now, the National Institutes of Health reports that ED is frequently seen in COPD patients, with hypoxemia and physical activity limitation being contributing causes. Dr. Al-Nakib further elaborates, the exact mechanism is still unclear, but it's been noted that low oxygen levels play a key role in erectile dysfunction among COPD patients. There's another risk factor that COPD patients need to be aware of, and that's smoking. Research shows that smokers with COPD tend to have much more severe ED issues. Dr. Al-Nakib advises, smoking cessation may reduce sexual dysfunction in ED and COPDers. I would advise them to stop smoking and increase physical activity. Even something as simple as walking does improve their endurance and does lower the incidence of shortness of breath. While there is no cure for COPD, treatments can help manage symptoms and control exacerbations of COPD or help prevent additional damage in the lungs. A recent study found that 60% of sexually active people with COPD had to make changes to their sexual life because of the condition. The National Institutes of Health states that it's important for physicians to question the sexual functions in patients with COPD. Echoing this sentiment, Dr. Al-Nakib stresses that all men should focus more on their health and be proactive with their care. This is a reminder to all that it's not just about managing a condition, but about improving the quality of life for those living with it. Remember, knowledge is power, and understanding the connection between COPD and erectile dysfunction is a step in the right direction.